If I have an AED, naturally you have to place the pads. If you're by yourself, that's okay. If you're in a school setting, Miss Michelle's here and we have somebody go down, me and Miss Michelle's going to make sure everybody's going to be out of our way. Nobody's going to see this child exposed. If we have to, you all will turn your back and you will make me a privacy circle. And I will do what I have to do then and get that brassiere off and all that. But for just to do CPR, on this video it states to take that off. We're not doing that in a school setting. We're going to do the best we can to press through those clothes. And when EMS gets here and they can get them in a private area, everybody's out of the room, they can do what they need to do. But we will not remove those clothes unless we have to have the AED. And if it's that severe, we're waiting on EMS and we've got the AED, then we're going to evacuate everybody out except for that person. So, just want to let you know because I have a lot of questions. It's like, what am I supposed to do about that? Now, when you get the AED, if you guys are having to perform with an AED, you will have to take scissors. You will have to get those clothes off. If they've got a t-shirt, cut a strip, rip it up. Hopefully you won't have to do that, but you never, in this day and age, you don't never know. You could possibly be giving CPR to a 8th grader or God forbid, a teacher or whatever. And listen, if it's me, do what you got to do to save me. I don't care. That's just the way it goes. I mean, I'd hate for anybody to have to be exposed to, all this luscious. But I'm just saying, do what you got to do. But if you have to use the AED, you will have to cut away those clothes. You will have to get those clothes. I mean, and you really can't pull them up here because you're still watching those breasts and stuff. And when you go to do your head tilt, chin lift to open that airway, that will restrict if you've got a big bulky hoodie or something up here. So you will have to cut their clothes. If they have a brassiere, you will have to get that out of your way. So yeah, it's not a lot of fun, but just be saying, in the healthcare, you're going to be exposed to a lot of crazy stuff, guys.
Make sure the scene is safe. And make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. Shout. Sir, are you okay? Are you okay? Help, help, I need help. If someone comes, have that person phone 911 and get an AED. You phone 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions.
So guys,
how many chest compressions you
you're
got?
going to
Do it.
Go!
I guess that stops.
That's not on top. Don't hit your arms. Right here. Don't hit your elbows. Look like this.
You're going to be on their side. You have to be on the side because the way you're standing, you forget he's a full body. He's got legs. So you're going to have to stand on that side.
Here, look like this. What?
So he's going to be sideways. Here, we'll take that off. Again, watch your placement. Between that nipple line right up above the median sternum.
Switch your hands around. Switch your hands around the other way.
I
think he's dead.
How long she's not even over here? I don't think you're pushing hard.
Okay, let's not kill them.
He's already dead. Good point.
Where's the AED at?
Take over. Our depth needs to be about like this. So you're going to go deep. That's why I say here it's harder. And when we do checkups, I have these nice little cute compression
Take over.
bracelets that's going to turn red and green when you all do
Put your
compression.
hands straight down.
And once we stop, we get this down ready to start.
1, 2, 3.
Hello, I'm Raleigh Acorn.
I'm Dax Payne.
And I'm Carly Cottle. Today we will be talking about CPR. What are some hand movements that you do when doing CPR?
You need to make sure your hands are interlaced like this, and they're right below the nipple line.
What would you do if this was in a real life scenario?
You would check to see if they were responsive. If not, you check to see if there's a pulse. If there's not a pulse, then that's when you start chest compressions.
Do you guys know what CPR means?
Yeah.
CPR stands for cardio-compulsory resuscitation.
What would you do if the person was unresponsive?
You would dial 911 and get an AED, and then you would start chest compressions.
What do you do with an AED?
You put it on them right there.
You would cut off all their clothing, put a patch here, and then deliver the electric shock.
What if it was a girl? What would you do?
Keep the clothes on.
With chest compressions, you wouldn't do anything. You just try to give it through the shirt. But if you had to give an AED, you'd have to cut off their clothing.
Okay. What? Hello, and I'm here again with,
Miss Vonda.
and we are going to talk about more of basic stuff of CPR. So, what are more like basic things that you haven't taught your class yet?
So far, we've just started on the compressions, the depth, the rate, and getting that rhythm that they need for efficient compressions. We still are going to do the first aid, the AED, and we haven't touched the infants yet.
So, when you do go to infants, then what will you do with them?
I will show them how to do if they are choking. I will show them how to do the stimulation if they are non-responsive. We will go over the CPR on a infant with the one person and the two person, and some clean sweep for choking, and that's about it on the infants.
What about the rhythm?
The rhythm is very important because, again, the heart is a muscle. And so what we're trying to do is we're trying to mimic the regular heart rate of that age-appropriate person. So what I'm trying to do is get them in that rhythm to where it would mimic that heartbeat to get them stimulated again.
So, can you use an AED on a infant?
We do have pediatric pads, but as far as an infant goes, luckily most of the time, if an infant is non-responsive, we do the CPR until the EMS arrives. I've never had to do an AED on an infant, but we do have pediatric pads for youth.
Okay, so what about the first aid?
First aid, we're going to do the choking. If we need, I do cover with mine, even though it's not protocol for CPR, I will go over some of the diabetic concerns, low blood sugar, which is what diabetes can have, hypoglycemia. And then we go over, usually if somebody's got stroke, I will show them the signs of stroke and what to look for. If they see those signs, that's what we're looking at. And just the Heimlich maneuver for the choking and those.
Okay, thank you for having us interview you. We will see you hopefully next time.